Makofi jamani kwao, makofi.
Excellency, these tablets are meant to empower the CHAS to undertake the digital reporting, as the CHPs already have phones that they report through the ECHs. So we kindly request that you present them to the representative of the CHAS. Mr. Koech.
Tupakate heshima hapa. Makofi jamani, tuongeze makofi.
Your Excellency, Deputy Governor, and all members of the Department of Health, our community health promoters, our community health assistants, our team leads, our med-sups, our very, very supportive partners. Good morning. Good morning. I'm here to do a very precise piece of work, which is to welcome His Excellency, the Deputy Governor. But before I do that, I want to make one or two notes. Number one, to acknowledge you, Deputy Governor. You spent at least 2 hours with us this morning. If I look around this room, these are your staff. They should be somewhere else doing other things. But you've led us to dedicate time to think through this issue and through this programming. That is leadership. We want to thank you and to acknowledge you for doing that. The second acknowledgement is for the Ministry of Health. Dr. Mercy, you know we've met severally. She's been here in this county severally, DG. The first time, I think when we met, we were with the Council of Governors, initiating this program at the baseline. And she spoke the way she spoke, with a lot of passion, and saying, you guys, Department of Health, you've got to be serious. You remember, Dr. Wafula, you were there. Thank you very much, Ministry of Health, for holding our hand without msomo mingi mingi. You know, you always remind us where we are going wrong and set us in the right path. Thank you for making time to be with us here this morning. We don't take it for granted. And thank you for the kind things you've said about Nakuru County. Let me also thank AMREF Health Africa, here represented by Dr. Kanari, and I saw Bill somewhere, I don't know, somewhere, coordinating things. Stella is here, she has also left to coordinate things. Johnson & Johnson, Mr. Getao, our neighbor, he said it's from here, it's true. Every time he leaves the meeting, he goes to see his mom. Then he forgets to come for the meeting the next day. But it's okay. We thank you for choosing you and AMREF to work in Nakuru. Thank you very much for this. Let me also acknowledge the County Health Management Team. Every single member of the County Health Management Team has got a piece of work to do. We've left the mental health coordination work to the Division of Nursing, to Dr. Wafula, Lydia, and the entire team that is coordinating this program. But today we've seen you here, and Kembo, umechapiwa makofi sana. Sijui kama tunasema kupigiwa makofi. One day we will sit and have a conversation, Dr. Kanari, Dr. Mercy, about the SHA component, the mental health component within SHA. Ama niaje? So Mr. Kembo, you lead us with, pigeni makofi. You know, I used to sit on the board of SHA, so I know things. So thank you very much, County Health Management Team. Let me thank the med-sups who are here, the medical superintendents, and all the heads of our hospital and the hospital teams. You heard Wendy speaking about how we cannot leave this illness to one team. The fact that the med-sups are here and all of them are managing one primary care network or another shows that you're serious. DG, over the last, our Deputy Governor, over the last 2 months or so, we have re-energized our primary care networks. We want our primary care networks to be the house within which all programming in the Department of Health happens. Everything must happen within the primary care network. That is the law also, but it's also the right thing to do. So the medical superintendents here are now working with our team leads here who are in charge of the health in the sub-counties, so that there's harmony and synchrony. So kindly also take that message to the Ministry of Health. When we were developing our work plans over the last 2 months for the primary care networks, we have 16 in Nakuru. We required every primary care network to program mental health. So it is there, and we've got to do it. It is in the work plan, it is in the annual work plan, and therefore it will be done. So thank you very much, the MedSoup. Let me thank the team leads. You're not called team leads for I mean, it's not a joke. You're leading the team. And I always tell you, in Kuresoi, in Bahati, in Joro, where health is concerned, you're in charge. So the fact that you're here today is a demonstration of your commitment. Kindly continue to provide support for the community health assistants. I think we've clapped for them. But what I expect from you from here moving forward, and thank God this is July, because it's the beginning of a new financial year, I want to see the community health assistants elevated in terms of status. I want to see the community health assistants visible, because they're the ones who animate the work. So you mkona kazi. I can see you clapping very heavily, Chas. Ni kweli, we need to see you in the front line. And then finally, our community health promoters. That's kit, and I was just whispering there with Dr. Kanari and saying what Dr. Daktari here has said is true. There are so many ways that we could tweak our public communication to communicate correctly and at the same time be effective. But it's up to me as a leader in the Department of Health to fix that. So I was just talking with Dr. Kanari, and we will fix it. We will make sure that all the communication that you give, whether it's through the skits or it's through music, is doing no harm. Ama mnasemanga hivyo madaktari? Yes. You're doing a fantastic job. And on that note, I would like all of us to give a 5-factorial clap to our community health promoters. 1, mtis clap kwanza, wacheni haraka. 1 for the sacrifice. These are men and women with families. Have you ever thought about that? Who wake up every day to serve. You only serve on Sunday. Me, I only serve, I don't know, on Wednesday. Them, it's every day. They will go and knock on that door and you will refuse to open. Tunafunguanga? Si tunakataa kufungua. And then we will say, Mr. Kemboi here, when I ask him why we are at 58%, Your Excellency the DG, in SHA registration, Mr. Kemboi atasema CHPs. Alafu atasema ngao. Ama? So, for your sacrifice, for your energy, for your professionalism, we will acknowledge you today. So we will give you a 5-factorial clap. Take that as our love of you. So let's do it now. Finally, as I welcome you. Oh, asanteni. Finally, as I welcome His Excellency, the DG, there's a famous saying by, I think it was John Bradford, that there but for the grace of God go I. Have you heard it? There but for the grace of God go I. This gentleman was observing prisoners being led to the cell. And he said to somebody, there but for the grace of God go I. I'm a very, very regular visitor of Ward 8. Very regular. I'm more a regular visitor of Gilgil, the psychiatry unit. I visit there a lot. And every time I go into any one of those wards, or go hang out with the patients as they play football at NCRTH, they have a space where they play football. By the way, I need some footballs. Also for Gilgil. Si tumesema to sneak in asks. I say to myself, there but for the grace of God go I. And so because it's an illness like any other, we commit ourselves. We will program this work. We will support our CHPs, we will support our CHAs, we will support our team leads, we will support our MedSoups. And we will deliver this thing. Finally, for Amref and Johnson, you know we've had many, many conversations. Many conversations. Some are nice, some are not so nice. Some we fight, then we get along, especially from me. But this demonstration here comes with an accountability, which I'm going to promise to His Excellency the Deputy Governor. that this is no mean feat. Somebody spent their resources to purchase this for us. So we will receive them, but we will be accountable, Your Excellency DG. We will be accountable. Send your team leads na DG, na CHAS. The same way we say to our CHPs, the phone, the tablet is supposed to help us to facilitate work. So we promise we are not going to take the tablets to our children. Do we promise? The second promise that we are giving DG is that these tablets that you're going to issue to the team will be issued to the office and not to the officer. So, if tomorrow, I'm Cha, my name is Ansela Monari, and I get a job to go Maju to Sweden, because I will, see I will, nitaachia huyo mwenye atachukua kazi yangu tablet. Itakuwa hivyo. We shall be accountable.